So during COVID, Belfast HR and OD Directorate worked in partnership with a number of key stakeholders in the community. Provision of bicycles, for example, for our staff to get to work, partnered up with free transport, free parking for staff on our sites. Our meals within our canteens were provided free of charge for our hard-working staff. And also we reached out, and our community supermarkets and chemists were really supportive of our frontline workers, providing lots of gifts from comfort packs to meals and to drinks.
We had a very successful workforce campaign carried out by HR to enhance overall workforce capacity across all professional groups, including a regional workforce appeal, significant engagement with universities and call out to retirees. The Workforce Appeal campaign in itself generated 3,365 applications to the Trust, 843 clinical and 2,522 support roles. A central redeployment team was established within HR to support the redeployment of staff right across the Trust.
We also worked in partnership with our early years social work colleagues, and we've provided a huge number of childcare places for our staff, and we've also reached out with our local school providers in terms of looking at venues for our summer scheme, which we will be delivering earlier than normal. Providing our staff suitable alternative accommodation has been a significant project, and it has supported our key workers to remain in work and safely shield from their families. We've reviewed how we onboard our new starts, moving from the single onboarding event that we held each month to a digital onboarding approach, which has been very successful, and it ensures that our new starts cover all of their statutory mandatory training and are inducted and supported into our organisation. Since the 1st of April 2020, 606 new staff across all professions have been onboarded through our new digital approach, and an 88% training completion rate, thus supporting staff health and safety and provision of an appropriate welcome despite the challenges we've experienced during the pandemic. Supporting our community colleagues has been key, and HR have been instrumental in setting up COVID-19 facilities within the community and identifying and sourcing the appropriate workforce for those. We've engaged with other key stakeholders such as our primary care colleagues and the independent sector to enhance service delivery. We developed a number of guides for our staff and managers, and these have been designed and presented in a user-friendly manner using Page Tagger, and they convey key facts and signpost our staff to additional information sources. And we've developed supporting our staff and their families during COVID, key guidance for managers and wellbeing support for managers. These have been very successful with thousands of hits. In partnership with our regional HR colleagues, Public Health England, Public Health Agency and the Department of Health, we developed a suite of frequently asked questions for HSE staff, and these were based on popular employment-based topics, and they relate to how staff are affected during COVID-19. They're regularly updated and they reflect emerging best practice and UK government guidance. In partnership with our HR, trade union, corporate communications colleagues, we developed a suite of video podcasts which address a range of key employment matters that have been widely raised by our workforce, including social distancing, pregnancy, risk assessments, psychological and emotional support. They've been posted on Facebook and have had upwards of 22,000 views. A central Ask HR 19 email address was developed as a single point of contact for resolving any employment issues for staff and managers. This has proved really effective in streamlining information for our staff and ensuring that their queries are replied to in a timely and consistent manner. We established a number of helplines for our staff, including a COVID-19 helpline and a confidential psychological support helpline. It's been really useful for our staff in terms of providing that practical support for them. In addition, we have a COVID-19 support line for staff who may have concerns about the pandemic and its symptoms and how it may impact them and their ability to work.